Health disparities significantly impact the deaf and hard of hearing community, particularly in the wake of the COVID-19 pandemic. Lack of access to health information for deaf patients and lack of provider training about issues faced by deaf individuals contribute to these disparities. Mask mandates and visitor restrictions have disproportionately affected deaf patients, making it even more important for medical providers to establish trust and understanding with this population. This video will provide insights into the unique experiences and challenges faced by deaf patients and equip medical providers with tools and knowledge to better serve their deaf and hard of hearing patients. Let's look at some different communication scenarios. Don't expect patients to lip read. While some deaf and hard of hearing people are able to lip read, it isn't always the best. It's one of the least effective forms of communication. If they write something down and give it to you, don't respond in speech. Not everyone lip reads. Even the best lip readers miss quite a bit of communication. Even if a patient is comfortable lip reading, it's important to remember that only 30 to 40% of speech sounds can be lip read, even under the best conditions, and extra information is usually required to understand what is being said. Talking louder or slower does not help with lip reading and can come off as condescending. If your patient is comfortable with lip reading while waiting for an interpreter, speak normally, yet clearly. While lip reading should not be the only form of communication while working with deaf patients, allowing patients to see your mouth while speaking allows them to gather additional context, know when it is their turn to communicate, gauge tone, and use lip reading as supplemental information to the primary communication method chosen.
I am tired of having to constantly educate providers about my rights to communication as a patient. What is a reasonable accommodation to them may not be effective communication for me. It's exhausting and energy draining, and COVID-19 mask policies can make it impossible to lip read. And one person or no visitor policies make it really hard to have an on-site interpreter for those who need one. It's like they think it doesn't matter that I want access to full information. I dread medical appointments when that happens. I love when doctors are aware that I need to see faces to understand the emotions behind the message. One doctor was so flexible that he swapped his face mask for a clear mask.
Use lip reading as supplemental information, not the only source of information, and speak clearly and naturally using gestures and expressions to help convey meaning. Be willing to repeat or rephrase important information to ensure the patient has understood it correctly. A few things went wrong in this scenario. First, try to avoid using shorthand or abbreviations. If writing physically, write clearly with your best handwriting to avoid misunderstandings. Don't say never mind or it doesn't matter. This is a breakdown in communication that can lead to health issues, incorrect prescription use, informed consent, and just a feeling of not being valued. Don't leave people out of the conversation. If you write or type with a deaf person, do not look down on their English skills. Remember that many deaf and hard of hearing people are deprived of language as children, and that English is a second language for many deaf people. When writing back and forth with a deaf patient, be willing to write and give them all the same communication in writing that you would give them verbally. This includes full sentences and using proper grammar. Look at the person during the written communication and have patience to finish the communication. Let's review some important things to keep in mind when communicating with deaf and hard of hearing patients before an interpreter arrives. Ask the patient about their preferred mode of communication and make accommodations as needed, such as providing sign language interpretation or visual aids. When writing, give them all the same communication that you would give them verbally. This means writing in full sentences, allowing time to write, looking at the person during the written communication, and staying engaged during the process. It's important to give additional context. This can include gesturing while speaking, demonstrating any actions needed, wearing a clear mask to ensure the patient can see your mouth, and never turning away from the person while communicating with them. Provide visual aids such as written materials, diagrams, and gestures to supplement verbal communication. Communicate with eye contact first and then type up notes on the computer if possible. Because sign language is a visual language, it may feel like they are not being listened to if you're looking at something else. Do not assume that deaf or hard of hearing patients cannot communicate effectively or that they do not understand what is being said. Remember to show empathy and understanding for the challenges faced by deaf and hard of hearing patients, and respect their preferred mode of communication. Be patient and allow extra time for communication, especially when using sign language interpretation or other accommodations. Many deaf people may not have access to information regarding COVID-19 due to the lack of accessibility. Be patient with those who might have concerns about vaccines. Patience and clear communication can help ease patient worries. Clear communication requires accommodations, so be sure to ask and follow through with providing the patient's preferred communication, typically an ASL interpreter, a certified deaf interpreter, or video remote interpreting. Sometimes patients will request video remote interpreting, also known as VRI. This can be a useful tool when on-site interpreters are unavailable or while waiting for an interpreter to arrive. It's important that all providers are competent in using VRI. This includes knowing where the device is located, understanding how to connect to remote interpreters, where to set it up in a room, and current device availability. VRI devices should be placed either between the patient and the provider or directly next to the provider, depending on the preference of the patient. Ensure the device's sound, video, and microphone settings are set to a comfortable level. Deaf patients have reported frustration with the video lagging and freezing, which impedes communication, especially when signing, so it's important to make sure there is a functioning high-speed internet connection. It's a huge relief when the medical professional is able to quickly set up the VRI connection. This shows competency in providing their accommodation. If possible, have it set up before the patient is in the room to reduce excess waiting and anxiety over lack of communication.
My worst experience of my life was not having an interpreter. How can that work? They do provide video remote interpreters sometimes, but that's challenging because the Wi-Fi connection and the breaks often. A live interpreter is much better. When I had my babies, I could not rely on my husband for communication. My mom is hearing, but I couldn't rely on her either. I needed a live person, a live interpreter there. But when my children were being born, they pulled in a video remote interpreter, a VRI. It is not the best. The best thing to do is to use a live interpreter.
VRI is a communication tool that utilizes interpreters remotely. It can be a potentially reliable source of communication for certain situations, but is problematic for others. When it is used, the internet connection needs to be reliable. A larger screen can help the patient better see the interpreter signing and minimize frustrations. Let's narrow down sight and sound to 4 things. 1. Accessing the environment. Someone has to share with the VRI interpreter what is happening off screen so they can relay the message appropriately. This includes nonverbal gestures like pointing to a specific area on the body or pointing at graphics. Second, the remote interpreter has to be able to clearly hear the person speaking at all times. This may require that the person speaking be close to the VRI system or have a mic system connected. The person speaking needs to enunciate the words clearly, including the diagnosis or medications. Third, the interpreter needs to know who is speaking at all times. Is it the doctor, a nurse, an intake staff, a cleaning crew, a family member, or otherwise? So remember to identify who you are each time you speak. Lastly, the lighting in the room and position of the VRI system in relation to the deaf person must be considered and worked through. It is important to check with the deaf individual if using VRI is an option they are willing to try before an on-site interpreter arrives. Ask the deaf patient if VRI is acceptable to them for that circumstance. Some patients feel VRI is an acceptable mode of communication for certain appointments, but unrealistic for others. For example, a patient might be okay with VRI for a quick COVID test, but not a life-threatening emergency or childbirth. If a deaf patient does not want to use VRI and prefers to pass notes or communicate in another way while waiting for the interpreter, respect that choice. In-person interpreters are usually preferred and minimize issues related to slow internet connection. When patients choose to have a live on-site interpreter, there are a few factors to consider in regard to your organization and state's COVID-19 procedures. Mask requirements have made effective communications between hearing providers and deaf patients more challenging for both lip reading and ASL for deaf patients. A preference for telemedicine during the COVID-19 pandemic can cause increased communication difficulties because ASL is a 3D language and key communications can be missed on a two-dimensional screen. Strict visitor restrictions in clinics and hospitals during the height of the COVID-19 pandemic limited access to on-site interpreters in some cases. As you assess the situation, remember to address the communication needs of the deaf patient. The patient's communication needs are a crucial factor in navigating all of the next steps, and this may require that one more body, the interpreter, be in the same room. Be sure to have a plan in place, reviewing and including state and federal requirements. Ensure all staff members understand what is allowed when it comes to using interpreters, wearing masks, and other factors necessary for effective communication. Communicating with the aid of an interpreter may be new for many providers and may feel strange at first. Here we will cover etiquette when communicating through an interpreter to help your clients feel acknowledged and respected. Let's take a look at some common mistakes.
For the COVID vaccine, I just have a few concerns. Are there side effects?
Tell him he might feel some muscle soreness, muscle aches, chills can be a side effect.
Okay. Any serious possibilities of side effects?
It is best to have the interpreter stand or sit next to the person who is talking, usually the doctor or nurse. This allows the deaf person to see the interpreter and the person speaking at the same time within their peripheral vision. If space doesn't allow for the interpreter and person speaking to be next to each other, ask the deaf person how they want everyone to be situated. This will help avoid confusion when the deaf person has to shift from one person to the other, as well as reducing the possibility of neck strain. Remember, when communicating with the patient, look directly at them, not the interpreter. Refer to the patient, speaking directly to them, using terms such as you or your, rather than tell him or tell her. When speaking, be sure to allow time for comprehension. Be patient for longer communication processes because interpreters need to interpret and make sure everyone is on the same page. Maintain direct eye contact with a patient and converse with him or her as you would normally with any other patient. It may feel odd because the deaf person is looking at the interpreter and not directly at you when you are speaking. You may be naturally inclined to look at the interpreter because they're the one verbalizing the message. But remember that it's the deaf patient that is actually speaking, not the interpreter. If you look at the interpreter, the deaf person may feel left out of the conversation because the focus is on the interpreter instead of on them and their health. Look at the deaf person and talk directly to them instead. If you need to type up notes on a computer, do so after communicating with eye contact if possible. The deaf individual may not feel listened to if you do not communicate with eye contact. Make sure you don't block nonverbal communication by turning your back or blocking line of sight. This can break trust because the deaf patient can't see facial expressions such as frustration or eye rolling. If you need to address someone else, you could gesture, "Hold on a minute," and turn your head so that the deaf patient can still see your profile.
I'm curious, with the COVID vaccination, are there any side effects?
You might feel some tiredness, muscle pain, aches, chills, but nothing too serious.
Oh, okay, that's good to know.
Much better. In order for patients to have equal access to health information, deaf and hard of hearing patients need you to communicate clearly and naturally. When communicating through an interpreter, it is crucial to articulate your words clearly and at a regular pace to facilitate a smooth interpretation. It is important for doctors to explain prescription instructions to deaf people because they need to understand how to properly take their medication to ensure its effectiveness and avoid any adverse effects. By explaining the prescription instructions in a clear and concise manner, using gestures and visual aids if necessary, the doctor can help to ensure that the deaf patient understands how to properly take their medication. This can improve the patient's health outcomes and reduce the risk of negative consequences from incorrect medication usage. The interpreter is there to facilitate communication between you and the deaf person. It's important to respect their role. When speaking to the deaf person, it's important to make eye contact with them, not the interpreter. The interpreter is only there to interpret the conversation, and the deaf person should be the focus of the conversation. The interpreter is only there to interpret and will not be offended when you are looking at the deaf patient. When speaking, it's important to speak clearly and at a normal pace to make it easier for the interpreter. Avoid using technical language or slang, as this can make it more difficult for the interpreter. Wait for the interpreter to finish before speaking or responding. Interrupting the interpreter can disrupt the flow of the conversation. Ensure that you allow for additional time for the interpreter to deliver the message and for the patient to make comments as needed before you speak again. It is appropriate and part of the interpreting process for the interpreter to take time to explain new concepts. Give them time. Your patience is greatly appreciated. Talk at a normal pace with pauses between new concepts or new information to make sure the patient understands their diagnosis or any instructions. You do not need to stop completely and wait for the interpreter to give you the signal to proceed. Continue to talk until the interpreter asks you to wait, and then wait for their signal to proceed. Interpreting can be a complex and time-consuming process, so it's important to be patient and understanding. It's important to note that allowing the interpreter time to convey the message clearly falls under your ethics as a medical professional, helping the patient understand their diagnosis, risks, and benefits of treatment so they are able to make informed decisions about their health. If you have any concerns about the interpretation or the interpretation process, it's important to provide constructive feedback. The interpreter may also ask you for clarification of concepts or terms in order to convey them appropriately. Work with these requests. The interpreter's role is to be a tool to effectively communicate between both you and the deaf person. Generally speaking, interrupting or talking over signing is not encouraged. But remember, the interpreter also serves you, so feel free to ask the interpreter what's happening. This can help to improve the quality of the interpretation and ensure effective communication.
When I make eye contact with my deaf patients and don't look at my notes or the interpreter, I can really tell it makes my patients feel valued and heard. Talking directly to my patients rather than saying, tell him or tell her, helps minimize confusion as well.
When I have a deaf patient come in, I can already expect that I will spend a bit more time with them, which helps me feel less frustrated.
Three pieces of advice that I would give medical professionals for working with me or any deaf person that speaks very well is to keep in mind, just because we're speaking does not mean we can hear you. Do not turn away from us. It will not end well. We will miss out on information you are trying to give us. And legally, we are entitled to that information, especially when we are the patient. Another piece of advice I would have: if we ask you to speak up, we're not trying to be rude. We're trying to be involved in the conversation and be involved in our own healthcare, which every health provider should want a patient to be involved in their own healthcare. It's kind of what makes the whole system work. And lastly, it never hurts to learn a little bit of sign language. If you go on YouTube and just find things that say top 5 signs for medical providers, I know off the top of my head 3 different creators that can show you the sign for medicine, nurse, doctor, allergy, breathe, blood, pain. I think I said pain already. But those are the kinds of signs that you will use every single day, whether you are working ER, L&D, ICU, med-surg, it does not matter. You will use those every single day. Learn them. It will make your life so much easier.
Every time when we go to the doctor, we always let them know ahead of time so we can get a request of a live interpreter. And so with the live interpreter, help us so much so we can able to, for me and my deaf wife, so we can see the live person in both ways, But with the VR, which is the video relay interpreters on the iPad, and it's harder because they only just focus on the wife, but I cannot see what's going on because they only have a rule only focused on the patients. If my wife is in the hospital, I can't see or know what's happening with my wife.
I recommend all doctors or nurses that they bring in a live interpreter, especially for emergency rooms. A live interpreter is needed for any type of emergency situation. What if my husband broke his ankle? That did happen, and it was challenging. We need a live interpreter there. Video remote interpreters can be improved. That whole solution can be improved. It's not the best. I encourage all doctors to provide better visualization and to look people in the eyes and to reduce the amount of writing back and forth between the doctor and the patient. That's it.
We know that medical providers and staff strive to offer the very best care for their patients, regardless of language, age, race, ethnicity, and disability. Taking these simple steps shared in this video can improve quality of care and health outcomes for those you serve. Providing ways to effectively communicate with a deaf individual may require learning more about their needs, but as you do so, the outcome will be a high-quality experience and increased trust. As you provide services for people who are deaf or hard of hearing, remember to be flexible, considerate, and listen. Ask the deaf patient their communication preferences. When using VRI, include the best practices we shared in this video. Have a plan in place for serious situations, and include the deaf person in the process. When using an on-site interpreter, remember to engage with the deaf person, not the interpreter. As you can see, there is a lot to learn and incorporate, but as you implement these things, your efforts will be noticed and valued. We appreciate providers and staff for taking the time to learn about deaf culture and how to accommodate deaf patients in a medical setting. By putting these practices into action, you can make a positive difference in the lives of deaf individuals and help create a more inclusive and equitable healthcare system for all.